navigating the evolving landscape of cannabis regulation in the United States. The current state of cannabis legalization in the United States represents a dynamic and intricate policy environment characterized by significant ongoing developments at both federal and state levels. This landscape is shaped by legislative efforts, evolving scientific understanding, and persistent business challenges, all contributing to a complex interplay between federal prohibition and widespread state-level reforms. Understanding these multifaceted dynamics is crucial for comprehending the future trajectory of cannabis policy in the nation. The core of federal reform, cannabis rescheduling efforts. A pivotal development in the federal approach to cannabis is the active consideration by the U.S. Drug Enforcement Administration, DEA, to reclassify cannabis under the Controlled Substances Act, CSA. This potential shift involves moving cannabis from its current classification as a Schedule I substance to a Schedule III substance. The impetus for this significant change began in 2024, following a formal recommendation from the Department of Health and Human Services, HHS. This recommendation is grounded in the acknowledgement of cannabis's accepted medical uses and its lower potential for abuse compared to Schedule I drugs. Currently, Schedule I substances, such as heroin and LSD, are defined as having no accepted medical use and a high potential for abuse, leading to severe restrictions on research and access. In stark contrast, Schedule III substances, which include drugs like ketamine and anabolic steroids, are recognized for their legitimate medical applications and are considered to have a moderate potential for abuse. The proposed reclassification of cannabis to Schedule III would therefore represent a profound shift in federal policy, officially recognizing its therapeutic value. The process has involved a thorough investigation by HHS, culminating in its formal recommendation to the DEA in August 2023. Subsequently, the DEA published a notice of proposed rulemaking in May 2024, initiating a 60-day public comment period that concluded in July 2024. During this period, the DEA received nearly 43,000 comments, with a strong majority expressing support for the rescheduling proposal. However, as of early April 2025, the rulemaking hearings, initially scheduled for January 2025, have been placed on an administrative pause by a DEA judge, delaying the final decision. Implications of rescheduling: what a shift to Schedule II means. If the DEA ultimately finalizes the rescheduling of cannabis to Schedule II, the implications would be far-reaching, impacting research, medical legitimacy, and business operations, though not leading to full federal legalization. One, enhanced research opportunities. Reduced barriers: researchers would face significantly fewer regulatory hurdles when seeking to study cannabis, as the stringent requirements associated with Schedule I substances would be eased. And deeper understanding: this improved access could lead to a more comprehensive understanding of cannabis's medical benefits and potential risks, fostering evidence-based practices and accelerating scientific discovery. When greater medical legitimacy. When official recognition, rescheduling would serve as a formal acknowledgement that cannabis possesses accepted medical uses, a stark contrast to its current classification, which denies any medical utility. Pathway for therapies. This recognition could accelerate the development and approval of FDA-approved cannabis-based therapies, integrating cannabis more formally into mainstream medicine and pharmacy. And business and tax adjustments. Tax relief. A significant change for cannabis businesses would be the potential to deduct ordinary business expenses under IRS tax code as the burdensome 280E provision, which disallows such deductions for Schedule I and II drug traffickers, would no longer apply to Schedule III substances. Improved financial access. While not a complete solution, rescheduling could facilitate access to more traditional financial services potentially. Easing some banking challenges. Though many federal banking issues stemming from the plant's overall federal illegality would likely persist. One, continued federal illegality for adult use. In recreational use status, it is crucial to understand that recreational cannabis use would remain federally illegal even with rescheduling. State-federal conflict. State-level legalization laws would continue to exist in tension with federal law, although federal enforcement in states with legal cannabis has largely adopted a hands-off approach, a trend expected to continue. Inherent limitations of rescheduling. Despite its significant implications, rescheduling cannabis to Schedule III would not resolve all the complexities surrounding its legal status and would have inherent limitations. No automatic federal legalization, then state-licensed businesses rescheduling would not automatically legalize state-licensed cannabis businesses at the federal level, meaning they would still operate in a federally ambiguous zone, albeit with some regulatory relief. Interstate commerce restrictions. In market fragmentation, it still would not permit interstate commerce of cannabis products, thereby maintaining fragmented state-by-state markets and preventing a unified national cannabis industry. 1. Continued federal criminalization. Hemp possession outside context. Cannabis possession would largely remain federally criminalized outside of specific medical or research contexts, limiting general public access and use. Legislative initiatives and business challenges. Beyond rescheduling, broader legislative efforts are underway to reform federal cannabis laws, reflecting bipartisan interest in addressing the current federal-state disconnect. Despite these ongoing discussions and potential reforms, significant financial constraints continue to challenge the cannabis industry, and in congressional efforts for broader reform. PREPARE Act, the introduction of the PREPARE Act, signifies bipartisan efforts to move towards federal legalization, directing the Attorney General to develop a comprehensive plan for national cannabis reform. Then is States 2 Act. The States 2 Act aims to empower states, allowing them to establish and regulate their own cannabis policies without fear of federal interference or prosecution, providing a clear framework for state autonomy. In persistent business constraints. On federal loan ineligibility, despite legislative discussions and the potential for rescheduling, cannabis businesses continue to be ineligible for federal loans, as explicitly clarified by the Small Business Administration. Financial hurdles. This ongoing limitation poses significant financial challenges for industry participants, hindering their ability to access capital, expand operations, and compete effectively with businesses in other sectors. Legal and public health perspectives. The evolving cannabis landscape also brings into focus critical legal consequences and public health considerations, influencing policy recommendations and the role of healthcare professionals. Legal consequences and protections. A report from the Nonpartisan Congressional Research Service's Legal Sidebar, published in May 2024, highlighted the stark contrast between strict federal cannabis regulations and the growing trend of states legally authorizing cannabis for medical or adult use. Appropriations rider significance. When prohibition of prosecution, a critical aspect is the annual appropriations rider that prohibits federal prosecution of state-level medical cannabis activities, safeguarding state programs from federal interference. Potential vulnerability, however, should this rider fail in future budget cycles, such state-level activities could face federal challenge, highlighting a precarious balance that relies on ongoing legislative action. And FDA approval and regulatory oversight. On prescription drug pathway, rescheduling would enable the FDA to approve prescription drugs containing cannabis, opening a new avenue for integrating cannabis-based medicines into mainstream healthcare. Provider prescriptions. This would also authorize healthcare providers to issue prescriptions for such FDA-approved drugs, facilitating their legitimate medical use under professional guidance. DEA registration. Any manufacturer or distributor of these FDA-approved cannabis products would be required to register with the DEA and adhere to all regulatory requirements for Schedule III substances, ensuring strict oversight and compliance. Public health, health equity, and pharmacist roles. A 2024 publication from the National Academies of Sciences, Engineering, and Medicine explored the profound effect of cannabis policy on public health and health equity, offering several key recommendations for future policy and practice. 1. Refine hemp definition. Congress is urged to refine the definition of hemp, providing clear distinctions on which cannabinoid products are subject to regulation under the Controlled Substances Act, thereby reducing ambiguity. 2. Clarify THC cannabinoid exemption. The DEA is recommended to specify that any THC or semisynthetic cannabinoid product derived from hemp is not exempt from the Controlled Substances Act, closing potential loopholes and ensuring consistent regulation. 3. Prioritize patient safety. State regulators should prioritize patient safety by adopting standards developed by USP, including rigorous product quality standards for cannabis products, ensuring consistency and purity. 4. Standardize product incorporation. USP standards for incorporating cannabis extracts into pills and edible products are also recommended, ensuring safe and reliable dosage forms for medical use. 5. Mandate staff training. State cannabis regulators should require comprehensive training and certification for all staff at cannabis retail outlets who directly interact with customers, enhancing consumer safety and education. Pharmacists are identified as crucial healthcare professionals in this evolving landscape, as highlighted in a February 2025 article in JAFA. Clinical competence. Pharmacists must possess a strong understanding of cannabis clinical use fundamentals, enabling them to provide informed guidance and manage potential drug interactions. Patient management. They are uniquely positioned to utilize their Medicat ion management and counseling skills to lead patient care teams in ensuring safe cannabis use, minimizing risks, and optimizing therapeutic outcomes for patients. On policy influence. Pharmacists also have valuable opportunities to contribute to cannabis-related decisions at the state level, often through participation in cannabis advisory boards and committees, leveraging their expertise in Medicat ion safety and public health. The ongoing evolution of cannabis policy in the United States reflects a complex interplay of scientific advancements, legislative initiatives, regulatory considerations, and public health imperatives. From the potential federal rescheduling of cannabis to the nuanced legal and business challenges, and the critical role of public health and healthcare professionals, the landscape continues to shift, promising further developments as stakeholders navigate the path toward a more coherent and regulated cannabis framework.